For those who are recording, Matt Lee, you all can go ahead and start. Saw your message. So to kick things off today, we're gonna start off with a video that we were able to create a few weeks, months ago. It's been a process, but we are wanting to talk about and highlight a new program that we have at the North Carolina AIDS Action Network, our HEP Ambassadors for Change. And so we are, working with a group of advocates. Some may be on the Zoom right now. And this group is led by one of our newest staff members, Deshae Coney. And he has been working with folks across the state, particularly in Western North Carolina, who are wanting to learn more about hepatitis and harm reduction and syringe exchange, and learn tools to be able to advocate in their community on those issues, and to be able to support folks who are living with those issues that it directly impacts people living with HIV, and working to empower our community in that way. So we wanted to do a quick little video highlighting the program and their work. So I'll go ahead and pass it off to Lee so we can start the video.
Hepatitis C is a virus that you can contract from contaminated blood that affects the liver.
Acute hepatitis C is usually when you're diagnosed with hepatitis C within a year of contracting it. It becomes chronic when it's been in your body for more than 6 months to a year, and it progresses to the point where there's liver damage.
There is a cure and treatment for Hep C. It's usually an oral treatment that lasts 8 to 12 weeks.
There are people who have personal, direct or indirect experience with someone living with Hep C or with harm reduction and substance use, and they use that experience to propel the mission of hepatitis C and harm reduction forward.
I am a hepatitis ambassador for change. I was an IV drug user for many years. I contracted Hep C and found out that I was positive when I was pregnant and wasn't treated till years later. I use that in my job now, that lived experience, just to support other people, because it can be overwhelming and scary. And a lot of the people that I work with don't realize that there are options for treatment if you're uninsured.
It is important to assist those that have contracted Hep C, because if we can assist them and treat them and break the barriers that they have to care, we can decrease the amount of Hep C that's spread in our community.
We are doing a lot of advocacy to increase awareness about hepatitis C, about things such as getting tested for Hep C, about getting confirmatory testing for Hep C, about making sure that doctors know how to treat Hep C and how to identify those factors that may show that someone is living with Hep C.
When I had it, it was scary and overwhelming, and I didn't know exactly what it meant. So I want to give support to those folks that might feel lost and overwhelmed.
If you know someone living with Hep C, make sure to be a support system for them as well, and definitely advocate in your community for more funding for Hep C.
The people who need it now need it now.
I love that video. It really gets to the heart of why we do this work. And, when we think about, the types of, diseases that are out there right now and illnesses that are out there, not everything has a cure. As we know, with HIV, we're still working on that cure, but with hepatitis, we have a cure, and people should know about that and have access to that and feel safe knowing that they can get those resources. So we have a lot of work to do to make sure that everyone who needs HEP treatment is able to have access to that. So if you're interested in more about that program, you can reach out to Deshay or anybody on staff. And we'll have some sessions actually tomorrow talking about harm reduction and Hep C if you're interested in that. But I'll go ahead and introduce myself formally. I realize I've been talking for a while and haven't formally introduced myself. Hi, everyone. My name is Christina Adeleke. I use she, her pronouns, and I am the Policy and Communications Manager at the North Carolina AIDS Action Network. I want to thank you so much for taking the time to join us this year for our conference, Building Power Across the Spectrum. We normally would be meeting in person, but of course, COVID is happening. Yet with all of the wild things that are happening, I'm so happy that we are still able to come together and keep some semblance of a routine and at least connect via Zoom. So before we start, I would like to briefly introduce our plenary speaker, Trevor Hoppe. He'll be joining us. We'll be having a conversation about HIV disclosure. As you know, in North Carolina, we've worked very hard to modernize our HIV criminalization laws. And, you know, we are excited that a lot of changes have come as a result for folks living with HIV, but, you know, there's still a lot of questions on the topic and in the area surrounding that issue. And folks have had different experiences with disclosure specifically, and particularly in the times that we're in, are seeing a lot of connections to disclosing and you know, stigma related to HIV, but then also seeing those kind of connections with COVID-19. So we're seeing a lot of interesting conversations happening around criminalization, happening around connections to HIV and to COVID. So we're hoping to have a conversation this afternoon on all of those things. And so I'll pass it off to Trevor to introduce himself further and to kind of lay the groundwork for the topic that we will be discussing. So go ahead, Trevor, I'll pass it off to you.
Thank you so much, and good afternoon, everyone. It is lovely to see many of your faces. Usually when I teach on Zoom, it's just to like a void of everyone with their camera off. So I'm very grateful that you are sharing your screens and letting me see your beautiful smiling faces, because it makes me feel a little bit more human and less robotic. My name, as Christina said, is Trevor Hoppe, and I'm a professor of sociology over at UNC Greensboro. And I'm really honored and excited today to be a part of this conversation. And if at any point I'm talking too fast, someone please like say something in the chat box. I'm naturally caffeinated this time of day, so I will try to slow down and be less speedy for interpretation purposes. So obviously, many thanks to Christina for the invitation, and also to Lee, everyone at the North Carolina AIDS Action Network for their hard work combating HIV stigma here in my home state. I really think they do great work, and so I'm really thrilled to be here. So today I'm going to talk briefly, I promise, before we have a bigger conversation about fear and about blame and about criminalization, HIV, but also thinking about this current moment that we're in with COVID-19. So rather than like talk statistics or like numbers or things that will, you know, put everyone to sleep, I thought I would start with just a story about my own experiences here in this current COVID-19 pandemic moment that we're all living in, right? Because that's why we're here in this little box right now, is because of this current epidemic. So it's really timely to be having these conversations. A friend of mine in Charlotte, that's where I live, recently sent me an invitation. He wanted me to co-moderate a new Facebook group. What was the purpose? Well, he wanted to create a group to post photos of people that he encountered in public who were not wearing masks in order to publicly shame them for their bad behavior, in his view. He was pissed off, outraged, furious that he would go out in public, go on a walk, go to the supermarket, run errands, and he would encounter these people not wearing masks, standing too close, making him uncomfortable. And he wanted me to kind of facilitate this, to co-sign this in this new group that he was starting. So I had a couple of reactions, right? First, a little sympathetic. I mean, I get it. You know, I was recently at a grocery store and there was a man standing pretty close behind me and he didn't have a mask on. I did, and I felt uncomfortable, right? My skin, the hair on the back of my neck kind of prickled. And I bet we're all kind of experiencing some version of this during COVID-19. Many of us are scared, and the impulse to point the finger at, you know, the guy behind me or anyone else who's not acting in a way that we think is responsible is really strong. That impulse to just point that finger. So that was my first reaction, right? I get it. You know, I know where he's coming from. And the second reaction is, you know, it's like, do you know me at all? Like, are we friends? Are we, do you know who I am? And that's because in 2017, I published a book, and basically the whole premise and point of the book is to argue that blame and shame is counterproductive to fighting epidemics. It's a whole book. And that was the point. But, you know, ego trip aside, right, stepping back, I sat down to kind of think through, how do I communicate to this friend that maybe this isn't the best strategy? Maybe this isn't, you know, the kind of thing we ought to be doing in order to combat COVID-19. But before I could even do it, my husband jumped into this group chat and took the reins. And Julie, thank you. The name of the book is Punishing Disease. I'll post a link to it here in a bit on the chat box. So my husband jumped in, and you know, just thank God for partners for doing these heavy lifting moments. And he explained to my friend Ken better and with a bit more patience than I might have. So no, you know, we could not be co-moderators of this group. And my husband asked him, you know, what was he hoping to accomplish? And my friend said that he wanted to call people out for their bad behavior and a pandemic. And then my husband really asked the tough question, the real question: do you think that's the best way to reach those people? You know, do you think that's gonna have an effect on their behavior? It is really tempting right now and in general to blame other people when we're scared. We think we are doing everything right, or as right as we can. And there are just these other people over here who aren't, right? We think we are doing what we can. Other people, maybe not so much. But the truth is always more complicated. None of us are saints or robots, right? Many of us, if not most of us, you know, I won't speak for everyone on the call, but I suspect that many of us are all privately, quietly, off of social media, taking risks right now that we'd rather not know others know about. I will confess, right? I will take the confessional. I recently had dinner with my parents. It was indoors. We didn't wear masks. I didn't take a picture of that, and I certainly didn't post it on Facebook because I can imagine the response that I would get. Now, granted, it was my home, right? There are precautions that we took. We weren't out at a restaurant. No one else was there. It was just me and my parents, yada, 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 right? But the point is that this action, this dinner, is kind of exactly the same kind of thing that my friend might have posted a picture of online, right? We were behaving badly in many people's eyes, and certainly in the eyes of many people on social media right now. So I could get into a whole different kind of story about thinking through why people take these risks. You know, in my case, I love my parents, and we were only in town at the same time for kind of a brief moment. We might have gone to an outdoor restaurant. That's ideally what we would have done, but it is so cold outside that, you know, they were not up for that, and so it was their idea. We are all human and we need connection, right? That's fundamental. And so none of us are going to be able to be perfect all the time in the face of these epidemics. But it's more than just a question of why we do it, right? It's also a question of thinking through what it is that's driving us so intently to blame other people in the face of a disease. It's like another friend, you know, recently told me, said, oh, I hooked up with this guy and he gave me gonorrhea. Oh, he gave it to you? Did he give it? Right? There is so much loaded into that phrasing. He did this, I didn't. It's his fault, not mine. So as a habit, right, my friends know me and I can be candid like this and a little bit of a jerk like this, but I poke my friends when they make these kinds of statements, and I asked back with a bit of a smile, are you sure that you didn't take it from him? What is the agency or the responsibility that's baked into this language, right? That this is something that someone else did to me. I'm just this innocent person, and here this other person has inflicted this thing on me. None of us are angels, right? We cannot blame our way out of an epidemic, right? That is fundamentally what I hope. If you think through, like, what did this guy talk about today? That's kind of the core piece, right? Blame is not going to protect us. It may make us feel self-righteous, you know. In reality, though, a virus doesn't really care who's to blame in a particular scenario. It will spread, you know, without regard to that. That's just not how epidemics spread, is through blame. I try, it's not always easy, but I try to take a glass half full view of humans and argue that most of us, most of the time, aren't out there maliciously trying to harm each other. For the most part, we're doing the best we can. And even more to the point, responsibility for the disease, any disease, HIV, COVID, isn't just yours and mine. We share it collectively as a society. So it's also the government's responsibility. It's also nonprofit organizations' responsibility. It's our family's responsibility. In the case of COVID-19, just like HIV before, our institutions have failed us. When I see that maskless shopper at Harris Teeter, you know, I have that moment where I'm like, you know, I feel so frustrated. I try to take a deep breath, and I think about a couple of things. I think about how the Surgeon General of the United States of America got on Twitter, I believe in April, to scold people for wearing masks. I think about how South Korea sent every single person in that country masks to use in their private life, while here in the United States, we were left to figure it out for ourselves. Etsy, right? That Etsy was where I got my mask, and it was just on a whim for the first time I was able to get a mask. I think about the President of the United States, who regularly uses his office to spread misinformation and lies about this disease. And I think about the CDC, which bungled testing from the start and still has failed to implement a national testing strategy that works. The last time I got tested a little over a month ago, my test results came back 17 days later. 17 days. That's not even worth knowing at that point. I'm either dead or better at that point. That's the world we're living in. Our systems have failed us, just like those same systems failed gay, bisexual, and men who have sex with men, and injection drug users and sex workers in the 1980s, while tens and then hundreds of thousands died. President Reagan didn't care the first time it came up at a press briefing. His staff joked about it the first time it was ever discussed at a presser. It was to them a joke, something only them, homosexuals, drug users, hookers, in their words, in New York or San Francisco needed to worry about because of their own bad behavior. History repeats itself, right? Here we are again, a president without compassion or science on his side, institutions either failing to act or moving far too slow to stem the spread of this disease. And all of us, right, left to our own devices. And what tools do we have? Blame is one of the only ones that we've got. Pointing the finger at our neighbors, our friends on social media for doing the wrong thing. Because all the other things that should have happened, have failed. And we're sort of left as individuals to do whatever we can to protect ourselves. So when that impulse to blame takes over, I just have one, piece of advice. Look up. I mean, not literally into the sky, right? But think beyond the you and me, right? The individual. Think about all the companies, right? The Harris Teeters of the world that aren't, enforcing mask policies. The governments that aren't, helping people get access to masks and doing testing effectively. And, sometimes the NGOs as well that maybe aren't stepping in to do the work that we could be doing as best we can to shape all these things that we see happening in our day-to-day lives. We all share the blame, right? Me, all of us, right? I'm not sort of suggesting any of us get out of this without culpability. It is our shared responsibility. It's not just the responsibility of that guy at the grocery store who's creeping up behind you, right? It's more than that. It's bigger than that. And so that's fundamentally why I think the criminal justice system is almost always the wrong tool for the job when it comes to combating infectious disease. Now, granted, there are rare cases when someone is out there to harm. And I'm not so radical as to sit here and say that there's no situation in which someone might need to be held to account for their actions. If right, I believe that they were acting with malice and in a way that actually posed a threat. Those kinds of cases are so rare. I have studied this. I have read thousands of cases, right, in the United States in which people with HIV were prosecuted for failing to disclose their status to partners. In states outside of North Carolina, usually that means a felony, and felony records obviously shape the rest of your life in many ways. A very harsh punishment, long prison sentences. And then if you just looked at the news headlines, you'd think that these folks who have been prosecuted were uniformly kind of psychotic killers who were hell-bent on infecting, murdering their partners. The truth, when you read below the headline, is always less salacious, right? The media loves this kind of stuff. It's red meat for them. But the truth, when you get down to it, is less sensational. Many people who have been prosecuted and convicted used condoms. Many still had viral loads that were not detectable, thus making it impossible for them to transmit the disease. And still others had oral sex or other kinds of sexual contact that posed no risk, like a stripper, a case involving a stripper I found in Michigan some years ago who was convicted of a felony for giving a lap dance. And even in those cases where HIV was transmitted, or whether it was plausible to have been transmitted, often at the center, you'll find a person struggling with how to reveal a piece of information about themselves that society has determined to be the equivalent of a scarlet letter. How can we expect disclosure in a world where HIV stigma is so ferocious that literally just the act of just telling someone can get you killed, right? That's not just sort of hypothetical. There are cases like that around the United States where disclosure is sort of set up. But of course, this is kind of a false security blanket. Most HIV infections are the result of having sex with someone who didn't yet know that they were positive because they hadn't been diagnosed yet. Condoms or pre-exposure prophylaxis, PrEP, are far more effective than disclosure from a public health perspective. Disclosure may, we may think it's the right thing to do or a good thing to do. But from a public health perspective, it's not a strategy for protecting ourselves or, our lovers for the sake of HIV prevention. And I'll just kind of end it there because I have read that many of you have great questions, and I don't want to hog so much time that we don't have time to delve in. But I hope that kind of lays some groundwork for thinking through not just HIV criminalization, but this moment that we're in with COVID-19, because I think the parallels are, obviously the differences, I don't want to say they're the same, they're not the same, but there are lessons that we can learn from both the history and present of HIV when it comes to COVID-19 and kind of vice versa. So I look forward to the conversation. I'm really grateful to be here. And I'll turn it over now. I believe I think they're going to have a kind of Q&A moment. So I'm not sure how that will go, but
yes, we have some questions that have come in previous to the conference from our friends throughout the state. We're going to have Rita McDaniel, our staff member, joining us to help read some of these questions. All right, so I've already sent her the list of questions. We're going to be hopping around because I know Trevor kind of covered some topics in his conversation, but we may have some opportunities to expand and to go further. So Rita, why don't we start with question number 5.
You were close. I was going to start with number 6. How is everyone this afternoon? Okay, 2020 has proven to be a year with significant high rates of physical violence toward transgender folks, particularly transgender women of color. We also know that transgender women are disproportionately impacted by HIV. Tia, a person living with HIV and is based in Charlotte, North Carolina, wants to know how to HIV disclosure requirements and HIV criminalization laws uniquely impact transgender folks. Trevor, it's on you.
Thank you for that great question. I think that's really important, especially as we know that transgender women are disproportionately impacted by HIV, especially African-American transgender women in the United States. It's a frustrating question for me as a social researcher because it is difficult, if not impossible, to see transgender people in the criminal justice system because they are not, their gender identity is not reported It is usually their quote unquote, birth sex that's reported. And so I wish I could answer that question with saying, with information in terms of the numbers of cases and the number of people who've been impacted by criminalization. But to the state, it's like there are no transgender people. It's really maddening and frustrating. They do not report that information. And that's not just here in North Carolina. I mean, that's basically every kind of state in the United States. Departments of corrections and criminal justice agencies uniformly basically don't report that information. So it's hard to know. Anecdotally, we know there are cases, right? We would know there are cases involving transgender women who have been prosecuted. But the numbers are challenging to get a sense of. So I know that's probably not satisfactory, but I think what is clear, right, is that transgender women in the United States are, have high rates of HIV infection for a variety of reasons. And so therefore we know that they are also living under these laws, right, in a specific way that they wouldn't be if they weren't so disproportionately impacted by HIV. So, I know that that's probably not the satisfactory and conclusive answer. I think we really need to know more information, and I think there would be room, I hope there's room for more research and more activism on how trans people are impacted by these laws.
Mm-hmm. So true. Rita, why don't you go to question number 6?
Tamara, a person living with HIV and is based in Salisbury, North Carolina, wants to know, in addition to transgender folks, other specific communities are especially vulnerable to the negative impact of HIV criminalization laws.
That's a really great question. Thank you, Tamara, for asking it. So this was a question that I asked in the book because I went in with certain expectations of what I would find, and I found kind of completely the opposite. So there's a longer conversation we might have. I could talk for a long time about this, but it is not, I expected to find that gay and bisexual and MSM would be heavily impacted. And what we find, in fact, is that most cases, disproportionately, the number of cases, I should say, involve heterosexual defendants, both men and women. And I think once you step back and you think about it a little bit, it starts to make more sense because, as a gay man myself, when I came out in Charlotte at the age of 14, the first thing that my parents said to me was that I was going to get AIDS, right? This is something we expect to live with in our lives. And so it isn't surprising or shocking in the same way to find out that someone you have been intimate with has HIV, in the same way that it isn't for heterosexuals, right? Because they're not taught that this is something they need to worry or think about. So, in the book, that's the argument that I make, is that HIV is seen as more of a threat to heterosexual people than it is to gay men and other MSM and men who have sex with men. But I really do think it's another area where I really think it would be great to know more, because all I can see is the patterns, right? That's what I see is sociologically who's being impacted disproportionately. But we need more research to understand what's driving those patterns. So I'm just sort of thinking through what I think is the explanation, but we do need more information to really answer that question fully.
Thanks, Trevor. All right, so we had a question from Tia, we got a question from Tamara, and now we have a question from Roger. Number 7, Rita, why don't you go ahead and do that question for us?
A person living with HIV based in Carrboro, North Carolina, wants to know how would you encounter arguments in support of HIV criminalization?
It's a great question. Thank you, Roger, because, and I used to live in Carrboro, so I feel connected in some way. It is tough because many people support HIV criminalization, both inside and outside the community, right? Studies will find that there are high rates, among people with that view. So that's not, you can expect to encounter that, right? I'm sure many of us kind of know that, right? We either, some folks on the call may hold those views themselves, or many of us know people that do. I just tried to talk through the reality, and I talked through some of these cases that I see, and I think try to talk through, do you really think that this person in this circumstance should be thrown in prison for years and then for the rest of their life be labeled a felon for this, this thing that happened that, almost none of these cases result in transmission. So there really is, the only harm usually is kind of the psychological duress that the person experiences, who usually is HIV negative, but in theory, they could also be living with HIV. There was a case like that. So if you just sort of talk through the reality of like, what are we trying to do here? What is the thing that is so dangerous or harmful that we need to punish using the criminal law? And I think in most cases, once you unpack the issue and talk about the reality of HIV criminalization, people can see that it isn't, the laws don't really fit, right? They don't connect well to the real core issue that people are trying to we're concerned about. But it's hard. I mean, it's difficult. I don't want to make light of that. It's a lot of hearts and minds to change in the United States on HIV criminalization. And recently I consulted with someone working for one of the presidential campaigns. I guess I won't say which one. Someone who did not get the nomination for the Democratic Party. And they were asking about HIV criminalization, whether they should be messaging about it. And my view really was like, we're not ready for a presidential campaign, I think, to be messaging about this, because we there's so much groundwork that needs to happen. I just don't know that a national conversation is really what we, there's a lot of risks there, I think, to potentially having a kind of backlash. And we saw that even in liberal states like California. They changed their law by removing the felony, and Fox News ran with that and said, liberals in California think it's okay to spread HIV without, repercussion. They boiled it down to the worst possible message. And luckily, in California, they were able to move forward with that legislative change, even in the face of that backlash. But in states like North Carolina or Virginia, others, it's tougher to trudge through some of that if there was such a backlash. And Wanda, I see you saying, I'm surprised a presidential candidate asked about criminalization. I was also surprised, but excited that at least it was on their radar. So I think our messages are getting through, at least in that sense, that people are aware that this is an issue. And I'm hopeful that that will lead to change.
Mm-hmm. Absolutely. We actually got a question related to relationships. I think someone's asking for relationship advice. Rita, hop up to number 3 and help our friend out. Lucy?
Okay. Lucy's a person living with HIV based in Raleigh, North Carolina. She's getting pretty serious with her handsome boyfriend, Ricky, who is not a person living with HIV and is based in Rocky Mount, North Carolina. She shows that since she is virally suppressed and lives in North Carolina, she is not legally required to disclose her status. She wants to disclose her HIV status to Ricky, but her best friend Ethel said that it was a bad idea and that she could keep her HIV status to herself. What advice would you give to Lucy? Should she still disclose her HIV status to Ricky, even though she knows she's not legally required? Are there any benefits to Lucy for disclosing her HIV status?
Well, first of all, my heart goes out to Lucy, and I have friends who ask me a variation of this question often. You know, they struggle with this decision, both in states with laws that compel them to do so and states that don't have these kinds of laws. You know, I'm not a relationship counselor, right? So I'm not qualified to answer that question in some ways. I wish I was. I would, you know, have not so many bad exes. But I guess what I would say is it's really always up to that person to make that decision. And there's so many variables at play. I think ultimately, you know, I have been in relationships with people living with HIV, and I'm always glad when they tell me that information, but it doesn't always happen, you know, the first date, and that's, you know, that's okay, right? Like that is something that I think has to happen on their own time. So I think for Lucy and for, you know, basically anyone living with HIV, they are struggling with that question, right? That is something that they have to deal with often, is the decision whether and when and to disclose. And like I said, I wish I could give a blanket answer, but I think the best thing is to do. You have to kind of come to your own kind of feeling about that and to make sense of it. And that's what I tell my friends when they ask me that, is like, I can't ultimately answer that question for you. For people who live in states with criminal laws, I do tell them this is what you need to be aware of, right? That this law exists in this way. So you at least want to be aware of what the context is. But in North Carolina, as you say, you know, if you have an undetectable viral load, right, you don't, you know, there is no legal responsibility or mandate to disclose.
Yes. Trevor, we have a question actually coming in from Dexter, and I'll go ahead, Rita. I'll read this one. How would you respond to Dexter, who is a non-binary person living with HIV based in Greenville, North Carolina? They were asked by their dentist about their HIV status and said that Dexter was required to disclose their HIV status for their records. Dexter refused to do so and calmly left their dentist's office and absolutely did not make plans to return to their dentist's office later that evening for a special visit. Since Dexter is based in North Carolina, why would they have to disclose their status to their dentist since they are virally suppressed? Who is right, Dexter or his dentist? Or their dentist?
Thank you for that question. Christina, we talked about this question in advance, and I tried to reach out to get an answer definitively because I'm not a lawyer. And so again, I don't want to give bad legal advice, but and if anyone is on the call that knows differently, you know, please step in. But
yeah, it's a little gray. It's a little gray. That's why I'm curious to just hear your thoughts. You don't have to lay the law down exactly today.
Right. I mean, to my knowledge, I don't believe there is a responsibility or legal mandate to disclose. Now, you may wish that your healthcare provider knows this because it may be important for them to know in the care that they provide to you. But you know, whenever I go get a massage, for example, I might get a questionnaire, a health questionnaire that asks me my HIV status, among a lot of other things. And, you know, in that circumstance, there's really no sensible reason to disclose. And so, you know, I don't want to say definitively whether or not there is a legal mandate to, but as far as I know, there's not. And I know people living with HIV that I know tend to sort of feel out those decisions for themselves, and often have to get to know a provider first before they, you know, make that information known. Now, obviously, your healthcare specialist, you know, who prescribes you HIV medication and tests your viral load and other things. Obviously, we want them to know, right? You need to get competent and good healthcare for HIV. Outside of that, as far as I know, it's more of a personal decision, as Monique says. But like I said, if there's someone on the call who knows something differently about that, please step in. But as far as I know, there's no legal mandate to disclose.
Yeah.
Would you disclose?
What's that?
Would you disclose?
So I am not living with HIV. So, you know, I don't face that decision in the same way. My instinct would say often no, but it's hypothetical in that sense, and I might feel very differently if my status was different.
Yeah, the only guidance I've seen is specifically for medical professionals who are living with HIV, not necessarily their patients. So there's that. One question that we have is from Olivia. Number 9, Rita, can you help us read that one?
Yes, I can. Olivia, a person living with HIV based in Asheville, North Carolina, wants to know about the tension that exists among folks in the HIV community surrounding U equals U, which undetectable means untransmittable. Many folks within the community found freedom from the shame and the stigma through U equals U, but some say the U equals U message could potentially create a division between folks who are virally suppressed and folks who are not virally suppressed. Can you tell me more about U equals U and your thoughts on the potential division in the community?
Absolutely. Thank you, Rita, for asking that, and thanks for that question. I think U equals U, when I started working on HIV criminalization issues, you know, there was no such thing as U equals U as a message. And I can really see how it's transformed the legal debate in ways that I think are helpful. And there are kind of a couple of reasons for that. One, you know, doctors feel real uncomfortable ever saying there's zero risk of something. And so oftentimes they feel compelled to emphasize the risks rather than the lack of risk. So the fact that we got to a zero message opened up a lot of people to feel like they could more definitively take a side, as it were, on HIV criminalization, to say, you know, if you don't have a viral load, you know, there is no, you know, ethical duty to disclose because there's no possibility of transmitting the disease. I think that is a positive step forward, so to speak. But of course, what that leaves behind is the harder question of, do we think that there is or should be a duty to disclose when you have a detectable viral load and or you're engaged in, you know, sexual practices that are likely to transmit the disease? So again, we could step back from that and say, if you use a condom, okay, you don't have to disclose. Or if the person's on PrEP, right, and that, you don't have to disclose. But still you're left, right, with this even harder conversation about, do we think that there is a role for the criminal law to play in cases where someone doesn't disclose who has a detectable viral load and engages in sexual practices that are likely to transmit the disease, or probabilistically likely to transmit the disease? And that's the real tough question that I think we're going to have to sit with and really think through, because I think it's almost like the low-hanging fruit in some sense. We've sort of, U equals U allowed us to sort of move forward and say, this is okay over here, right? This is okay where you have an undetectable viral load, etc. But then we have to think about who has detectable viral loads. Well, people who don't have access to healthcare, people who are newly infected, people who are poor, people who are Black and of color. It's compounding all those inequalities around HIV and focusing the criminal law on that group of people. From an inequality perspective, I think that's probably dangerous in that sense. And I think we want to really be careful. Having said that, in states like Michigan that have done this, where they have reformed their law to say, if you have an undetectable viral load, you don't have to disclose. As far as I know, in Michigan, there has not been a single case pushed forward of anyone under that law successfully, a person convicted under that law, since that reform was put in place. So it may be that the reform reduces to the point of near zero levels the number of prosecutions. I think the jury is still out on that, but that's a possibility that we won't actually see prosecutions like that. I don't think we know yet, and it is possible that we will. And it is true that it creates this divide between people with and without an undetectable viral load. At the same time, I think we would not be in the place we are today in terms of having this conversation and having other conversations and reform actually implemented by legislatures without U equals U. I think U equals U has opened that door for scared straight people to feel comfortable having this conversation, for lack of, a more elegant way to say that. But I do think more work is necessary to kind of push that debate ahead. And that's probably, the next 10 years of discussions will be about how do we move past, right, the limits of U equals U.
Yeah, it's so true. A lot of the, during our process locally and a lot of advocates I've talked to, the U equals U message was very crucial when it came to communicating with policymakers and allowing them to understand why these laws shouldn't be in existence. And I feel like we should definitely be thinking about science. All right, now this next question, I honestly feel like could be its own plenary session. So I want you to take the time to answer this question that came in from Fitz. Rita, why don't you go ahead and read it? It's question number 10.
Fitz, a person living with HIV based in Cary, North Carolina, wants to know what are the connections or parallels between the HIV epidemic and COVID-19 pandemic, particularly around treatment response and stigma.
Thank you, Fitz. That's a really excellent question. And I highlighted some of those parallels, in my first talk, but I'll at least say one more thing, which is I remember back in March when someone I knew tested positive for COVID. And they did not disclose that on to their friends or publicly for a long time, because they were very scared about how people would react. So that was back in March. It was a different time, right? I think now with 10 million and rising infections, we're living in a different context. But certainly stigma and disease, they're good friends. They always sort of seem to come together. So I think we definitely see that with COVID-19, even with just the rhetoric around it being the Chinese virus, right? That parallels the way that HIV was first called, GRID, or gay-related immunodeficiency. We like to stigmatize and blame and say it's their fault, and we've definitely seen that with COVID-19 being, labeled as the fault of the Chinese people or the Chinese state. Thus far, I haven't heard of a lot of cases where that's led to or fomented kinds of violence against Asian Americans. Thank goodness. So far I haven't seen a lot of systematic evidence that that's happened, but that's the kind of side effect that could happen, just in the same way that, homophobia in the 80s was ignited for so many based on the rhetoric around HIV and AIDS. So I definitely, HIV is not the same thing, right? It's casual contact does not spread HIV in the same way that COVID does. So they're very different diseases. But nonetheless, we see some of those same stigmatizing and punitive impulses kind of rear their head for both diseases.
Yeah, I would agree. I also feel like when it comes to how folks are treated, that level of sympathy is different. I feel like if you get COVID, you're going to get the thoughts and prayers. If they weren't wearing a mask, maybe people may be angrier or kind of a little harsher. But people living with HIV don't ever get that luxury, that privilege to get the thoughts and prayers. And I feel like you were mentioning earlier in the government's response, they were laughing.
Yeah, and I remember recently, again, it's like I try to put myself in this because I think we're all living this. I had a colleague who tested positive, and my immediate impulse, they reported it on Instagram. It was to scroll back in their Instagram to like 6 days before, and then there's this picture of them on like an outdoor party setting, and I'm sort of like, aha. We become our own little disease detectives. And then I sort of had to stop myself and say, why does it matter? Why am I so caught up in this? It is a very human instinct, but I think we should, try to keep it in check because it's not, productive.
Mm-hmm. All right, y'all. Do y'all have any questions in the audience that you want to ask Trevor? You can put it in the chat. You can unmute yourself.
Thank you, Alicia. I appreciate that.
Mm-hmm. I'm looking through right now. Oh, my bad. Got to scroll up. Questions up ahead.
Thank you, Wanda. Good to see you.
Oh, here's one. Have you seen any really great campaigns for community relating to COVID that you can point us to?
Thank you. Yeah, so I saw that question scroll past and I thought, oh, I want to talk about that, and then I lost it. So I'm glad that we're revisiting it. It's been really a slow response in that sense. And I think the first campaign I saw was in June there was a poster campaign in Chicago promoting testing, but it was the first time, and maybe it was mask wearing also, but it's like I can sort of vaguely remember it because there haven't been a lot of examples of this. So I think we desperately need it. Human behavior is hard to change, right? It is not easy to get people to change what they do on a regular, normal, everyday basis. So I think we can't take for granted that mask wearing is just this easy thing that people should be doing. We really have to be hammering at home all the time to get people to adopt that behavior. And even then, it's still not going to be, perfect. So I'm desperate to see, and I hope with the new administration, there will be an effort. Of course, by the time it kind of rolls out, it'll probably, there'll be a vaccine and we'll already have it in the rearview mirror. But it's just a reminder that we desperately need good public health campaigns to drive this message home, about mask wearing, about testing, et cetera, about it being asymptomatic so much of the time and why that's so important. There's so much about this disease that's that confuses people, that doesn't seem logical sometimes, that symptoms look different in different people. It's just a complex disease, and so I think it's hard to message that from a public health perspective. I also saw another question come in of what alternatives would you offer, suggest to the disclosure criminalization issue? And I think that's a really awesome question. I mean, I think criminal justice reform advocates have done a lot of work to think through what an alternate universe would look like, where punishment was not the only option, where we could have restorative justice programs that offer different remedies. So you may feel, potentially rightly, that someone has wronged you. In this case related to HIV or in any sort of potential criminal related issue, sometimes justice doesn't look like, for crime victims, throwing someone in prison. Sometimes it might look like getting them to volunteer at a local aid service organization, or to agree to go through some kind of counseling, or to just have a conversation one-on-one where they talk through their disagreement. You're not offered that in the criminal justice system. The criminal justice system offers victims no voice, really. Usually, you are just there. You can be there in the courtroom and you might testify against the person, but you are not the person sitting on the other side of the aisle, right? That's the state. The state is doing the prosecuting. So I think criminal justice advocates have argued that there should be ways to do other kinds of interventions that don't just involve punishing people. And I hope, those are the things that I think, that's the hope that I would have. And this is true, again, like not just for HIV criminalization, but really for all sorts of criminal legal issues. I think we'd be better served as a society if we came up with alternative models that don't just involve throwing people in prison and throwing away the key. Because I just don't think obviously, that has not fixed our problems. It's only compounded them. It's made things much worse.
We have another that came in. You saw it from Raymond?
Yes, I was just to say, do you know if there are any protocols or laws as far as blood donation sites notifying donors of positive results of HIV or other STDs? Many states do have criminal laws in place that would say you are criminally prohibited from donating blood, or selling plasma, for example, if you know that you're living with HIV. Those are very old laws by and large, and a lot of them are still on the books. So there are laws that would say that if you know that you're living with it, if you've been diagnosed, right, and you do, that would be potentially criminal behavior. As far as I know, there are almost no prosecutions like that. So just because there's a law on the books doesn't mean that it's actively enforced.
I had a question. I'm sorry to interrupt. I apologize. I moved here in February from Orlando, and I donated blood at a blood organization locally out here in Asheville. And at the time, I did not know I was positive. And the way I found out was a letter was sent to the mail notifying me of my status. So I was wondering, is there any or initiatives or programs out there trying to change that? Or if there's like
Um,
policies as far as notifying?
it's to encourage notification or to not notify.
I mean, well, no one really wants to be notified through the mail. And
Oh, change the mechanism,
yeah,
right? The way that you were told.
because I was never like, reached out by, it was a scary time. It was already COVID going on. So it was a lot
Yeah, and you
going on.
get this letter in the
I
mail,
just didn't,
right?
yeah, it's bothered me, the sense of how I found out. And I was just wondering if there's anyone else or that you've heard or known about with similar circumstance where they're found out that way. Usually they said they reached out by phone or a letter with asking for contact to contact them. I don't know. It just always bothered me since I found out that way.
Yeah, I think that's a great question. I don't know of anyone working specifically on that issue. It's probably up to your local health department to make that, to figure out what the protocol would be. So it may vary a lot from place to place. Because did the letter come from your county health department? Is that who?
It was actually I went to the blood connection. Um,
So that agency is the one that told you.
Correct. They sent me a letter in the mail. It's basically just saying they notify because they're based, I guess their headquarters is in South Carolina. So they notified South Carolina Health Department and then returned notified North Carolina Health Department. Um, so I was reached out by them before anyone else. So, but yeah, it's just something I would want to look into maybe changing or if there's any other, I'm sure there's better ways to
Yeah, I mean,
change it.
honestly, I would say bring your story. I would encourage you to bring your story to the agency itself and tell them what that experience was like, because you may be able to change how they do things. And maybe they assumed that someone was going to call you before that letter went out, but obviously that's not an appropriate way to inform anyone of their diagnosis. Um, so I'm not aware of, like broader, like if I, I don't know what the Red Cross would do, for example. I don't know what these agencies, how they let folks know. Except to say that I know they do test, and I'm sure they do encounter positive results on a regular basis. So there must be some protocol in place, but it's not my area of expertise.
Yeah, no, I
Monique,
appreciate that. I'm sorry.
Monique, do you have something to share on that? I saw your hand up.
Good afternoon, everyone. I work for a community-based organization. I'm an HIV intervention and prevention specialist. And I recently acquired a client. I run the PrEP program and the artist linkage to care program. So I deal with clients who are newly diagnosed as positive and those that would be considered high risk and are interested in PrEP. This has been an issue that we've been talking about recently. I have a new client who I acquired just that way. And I won't even get into, which was surprising to me, because those discriminatory laws, wherein if you say that you are of a particular sexual orientation, plasma clinics can legally say to you, no, we're not even going to draw your blood. It's really just preposterous. So this is what we're doing, and what I would really love to mobilize any community-based organization, any organization that does HIV testing, which we do, and intervention and prevention, to try to partner with these plasma clinics. This is just one step that we're trying to take, along with consistently reminding people to be tested regularly so that you know your status before you get into a situation like that. The other thing is for us to physically park ourselves, like physically in the parking lots of these plasma donation clinics, so that we can kind of we can halt the process. So we're there to say, get tested before you even walk into the plasma clinic. Let us test you. We have the fastest and most accurate on the market, though it's considered preliminary. It's 60 seconds, a finger prick. So we do that. The other thing is for me to make myself physically available so that anyone who receives that type of news, and by letter, I don't stutter. So I'm just really like taken aback by the fact that someone would just receive this letter, no support, no vehicles to help them navigate the journey of a new diagnosis like this. I think it's irresponsible personally. But this is what I'm working on us doing as an organization, challenging other organizations to do, to partner with these plasma clinics, to physically be there, to have someone there on the spot to help people who don't know what is going on, don't have resources or support in dealing with the rejection of not being able to donate or finding out that they have a positive diagnosis. I'd like to see it happen much faster, because suppose you moved, then what? A letter came to an address that was no longer valid. You're walking around not knowing what your status is and not being able to live your best healthy life. So that's extremely problematic. I hope you have written some letters or spoken to some people who are involved in giving you that information so that more people don't have to suffer through this. It's outrageous.
No, I agree with you 100%, and we're definitely working on that with my boss, trying to advocate for that because it was it was a certified letter, so I had to go to I missed the delivery of it and had to go to the post office to pick the letter up. So I drove to the post office and I opened the letter and I found out, and in the moment I was like, oh, okay, I'll look at this later, and then I leave the post office, and then just the anxiety took over, and you shouldn't be able to drive at that moment. It just was and I'm great now. I started medicine, and a month later I was undetectable, and and that's a great thing, but it's something I just really want to advocate towards and change, because I even checked like the profile that you make on the blood donor website, and my phone number was on there. Or, I just think they could have sent a letter at least saying, hey, do you mind reaching out to us, or do you mind coming in and speaking to us? Just not blatantly a letter, because then South Carolina Health Department knows now, and now North Carolina Health Department is just a lot of just like all my business is everywhere now. But it's something I definitely want to advocate towards and try to change.
Yeah, that's so maddening to hear. And I'm seeing in the chat that this has happened to other folks. I've talked to folks who have had similar situations where they've received a random phone call and received their status and didn't know what to do with that information. I feel like if we can, I think we need to think a lot about this issue and figure out more ways to advocate for folks. All right, a question came in right now. Trevor, can you share your thoughts on the community pushback around contact tracing and how that intersects with the HIV community's pushback on molecular surveillance? Good question, Matt. Go ahead, Trevor.
Sorry, I had to unmute myself. Thank you, Matt. That's a great question, and it's one that I've been talking a lot about with folks, because molecular surveillance is this new technology. Some people may not even be familiar with it. It's just trying to map through genetic testing techniques how HIV is transmitted along networks. So it's trying to map out how HIV spreads. And, from a public health perspective, it can be informational and helpful to sort of target interventions in response. From a privacy and legal perspective, it could have potential ramifications that HIV activists are very concerned about. If you could it become evidence, for example, in a criminal case against someone accused of not disclosing their status? Could that information be used to facilitate criminalization? And right now, that's a hypothetical, but ultimately, I think AIDS activists would point to a history where these hypothetical concerns that have been brushed aside have been borne out. So where, for example, back in the early years of the late 80s and 90s, some states were still using code-based HIV surveillance systems. So if you tested positive, there would just be a code that was generated in relationship to your name, your birth date, other pieces of information that could never be traced back to you specifically. And that was in order to protect anonymity and confidentiality. The CDC forced all states to move away from that and towards a names-based system. So now all states in the United States have names-based HIV surveillance. And AIDS activists raised a lot of alarms about that, that it could be used, there could be privacy implications, and HIV is so heavily stigmatized that they believe that was not a good idea. And we did see, for example, in Florida, there was a case where a healthcare worker kind of printed out the list of people with diagnosis HIV positive and shared it with friends as kind of like a do not have sex with this person kind of a strategy. So that hypothetical concern became a real problem. And I think that that is what is on the minds of AIDS activists who say, we need to prevent molecular surveillance from being used in these kinds of nefarious ways to facilitate criminalization, to potentially impinge on people's privacy rights, because there are real potential consequences that could be very bad. So the conversation is just happening right now. The CDC and other national HIV surveillance institutions are really intent on making this a new kind of rolled out strategy. And I think activists are sort of raising the flag to say, hold on, let's talk about this a little bit before we move forward. So the moment is now to be having that conversation, and they're definitely, call everyone you know who works for these agencies and ask them what they're doing to protect against the misuse of that information, because it needs to happen now. Otherwise, the hypothetical will become, potentially that reality.
In our federal conversations on this issue, it's always a touchy subject, but there's always this tension between folks who are bringing up valid concerns about people's privacy and security. People also bring up, people's immigration status and how that could, or documentation status, and that could impact, the contact tracing, particularly if they live in rural communities. But when you think about these conversations that need to be had, how do you think we should go about having it? Because normally when we have these conversations, there are folks who have those concerns, but then there are folks on the other side who are like, but look, all this great data that we're collecting. Oh, we need the data. You got to have the data, and can't ever see outside of the data and fail to realize that there are very real collateral consequences. And that was pre-COVID, mind you. Now, in COVID time, where people are very nervous and scared about COVID and they're rushing out this vaccine and doing all of these, making a lot of moves, how can we realistically have this conversation when before this time, people weren't even really wanting to have that conversation? But then now I feel like coupled with the COVID fear, is it like, are they going to be completely, tuned out to that? Or do you think there are certain things that we could say to help move that conversation forward?
I mean, I think it takes a social movement, and I think the lesson of ACT UP is that it really took people protesting en masse to get harmful policies changed. and they didn't just change out of some goodwill. And so, my instinct would be to say, revolt, because a polite ask will not get you much, especially from the CDC and other agencies that fetishize data to the point of that's all that matters to them. They can't see past that. And I believe that they are doing good and their heart is in the right place. But I also think that they can't see the on the ground reality that people are living in, where we are very concerned, and rightly so, for how this information could be used. And so it really does take advocacy and organized advocacy to change the course. So I don't think that, one phone call or a letter is likely to change the reality. It will probably take something much more concerted and organized and forceful. And unfortunately, we live in a world where ACT UP, doesn't really exist in the same way that it used to. There are some chapters that have some members and are active on some issues, but we don't have those kinds of grassroots organizations advocating in the same way. And we also live in a world where many of our HIV organizations have become medicalized. They're essentially clinics now, and so there's not a political focus. North Carolina AIDS Action Network is not one of those. In my experience, I think y'all do invest in these legal issues and political issues, but that's becoming rarer and rarer. So I mean, I don't. It's sort of, I don't want to be despondent about it, but I think it is. There's a lot of work to be done, and it will require, I think, being to mobilize people systematically to say that this is not to say that this is not what people want.
Trevor, I was hoping that you were just going to fix it for us. I thought you were.
I'm a sociologist. I just tell you the problem, and then you have to fix it, right?
Of course. Ooh, another question came in from Esther. She's asking, at-home rapid HIV/syphilis tests will soon be available in our state. How will contact tracing, criminalization/stigma impact efforts? That's a good question, Esther.
Yeah, and there are COVID-19 at-home tests that are rolling out too. I don't know, Esther, if you're, I don't know what the plans are in North Carolina related to that. I don't know if it's going to be publicly funded or free to people.
Are there any case managers on the line who may have some information on that, or folks who work in that space? I know that it's been trickling out, so some people have been having access. All right, go ahead, Trevor. Just wanted to leave the room just for space. Go ahead.
I think what we've seen previously is that these tests have been pretty expensive, and so I don't know that they've been especially widely used or especially helpful as a national testing practice. But perhaps, Esther, maybe that you're seeing some movement on that, where there's going to be more of a systematic effort to use at-home testing. I think that kind of practical question of what that will mean for contact tracing and other efforts is a good one. Certainly, if you are tested at home, that's already a sign that you're invoking some kind of privacy right there, right? A concern of privacy. And so maybe people will be less likely or less interested in participating in contact tracing. For example, Shalonda notes that the Carolina Cares Partnership is offering free at-home tests given to them by Greater Than AIDS. So it sounds like this is happening. It's a great question of what would that, how would those efforts impact criminalization? To my knowledge, it's like I've never seen a case where that came up. So to me, I'm not exactly sure yet, but I think it's definitely important to consider.
Yeah, question that's coming up, how does so let's say if someone is positive, how does that notification happen?
So, Christina, I attended the North Carolina Prevention and Care meeting last week. And so the state, North Carolina Department of Health is getting ready to roll out. They coordinated with some, partner with some other individuals to get these at-home HIV and syphilis test, rapid tests out. So that was my question. And they said they put things in place, but it was really vague. So I was like really curious because they said that they reported that why they're doing that is because their testing rates is down all across North Carolina. Nobody's getting tested. So they're concerned about that because if nobody's getting tested, then perhaps HIV is in these little pockets that's growing. So I was just interested to hear if someone else on the call had heard of that or have thought about that, because my fear is if they're going to start bringing up this conversation about HIV criminalization, they can attach that to the rapid testing. I just want to make sure that if that happens, that we're prepared for that. So I just wanted to bring that up.
Mm-hmm. Shalonda is saying here in the chat, because someone asked, would you need a confirmatory test to get into care? Could that be contract traced in that way? Shalonda is saying, same as if in person, we will schedule the confirmatory test and have mental health counselors contact the client. We haven't had a positive yet. Also, we have a linkage to care coordinator who will also contact client.
That's if the individual, that's if the individual reports that the test is positive. So,
yeah. And I'm thinking about folks who may get, let's say, a positive test, and what if they don't say anything? What if they just keep that to themselves? Ooh, so many questions,
Christina, I'm sorry. I thought with a at-home test that they provide whatever specimen and send it in and they don't get an immediate response. So please clarify that for anybody who knows about at-home testing.
No, they're testing at home, getting the results. That's my understanding. They're testing at home, getting the results. And if it's positive, they have the contact information, and that person is supposed to report the test or agree to report the results and then be scheduled to come in for testing.
Is there more than one way to go about doing this? Is there some people who are mailing in the specimens and some people getting?
Well, they haven't initiated yet. They're working with, I forgot who it is, but they're partnering with another agency. I'm not sure if it's in California, that's doing the at-home HIV and syphilis testing. So they may put that in place, but that was my thought, is that because they're trying to make it so that people can do it at home, and but I see a lot of things wrong with that. And if we're talking about making sure the community as a whole, and then, it's all kind of barriers. I wouldn't want nobody to be alone and find out that they have a positive test. See, that's potential for a lot of explosives. So I was concerned. They really didn't want to answer me. They usually don't want to answer me at the state when I ask a question. It's okay, I'm not going anywhere. But that was my question, and I'm gonna keep on saying something about it until they give me an answer.
Esther, you're not the only one with that question. A lot of folks have been bringing it up and have been thinking about different concerns that they don't know about. So I feel like we definitely want to advocate more on this and figure out more. I think I saw someone's hand go up. Go
It
ahead,
was me.
Shalonda.
Go ahead.
Yeah, so I
Thank
just
you.
wanted to jump on really quickly to say that the test that the CDC actually gave us, greater than AIDS, they have the results. So it comes with a little guide and it walks them through from step 1 to the very end, reading the results and everything. But the way we have structured it and set it up, we actually want to do Zoom or video chat or by phone with the client as they're doing the test. So that way they're not alone. So that kind of eliminates that barrier. And we've also wanted to, like I said in the chat, incorporate mental health, because we know that if they are alone and they do receive that positive, we don't know what kind of reaction they're going to have. But we did also think about the part of people not actually contacting us. So we put it in our protocol and our policy that if we don't hear from the person within like 48 hours, we'll give them a call as well. So Carolina's Care, we've tried to kind of think of every sort of avenue, with this at-home testing, because contact tracing is going to be difficult. I mean, at the end of the day, and we're kind of leaving something huge for people to report. So yeah, we try to think of a lot of things, and it was a lot to type in the chat. So I just kind of wanted to jump on and share that with you all.
Thank you, Shalonda, for sharing. It's so true. There are so many things you have to consider, because you, on one hand, want to make testing accessible for folks and get it and make sure that people have all the opportunities that they can. But then you also, on the other hand, want to make sure that people have the support that they need given their result, and then if they can actually get put into care and treatment. Look at us. We're at 2:59. We have 1 minute.
Christina, can I just say a couple quick things on this? Because everybody, this is Lee Stora with NCAIDS Action Network. Actually, I think this has been a really interesting and robust conversation about at-home testing, and I think we probably could talk, another hour and a half just on that alone. I feel like I've seen some really thoughtful stuff in the chat too, just about, what at-home testing looks like. And I think we all might have different opinions about how best to do at-home testing. I mentioned, like, there are certainly a number of companies who are doing, at-home testing where they mail you the packet and you mail back in. But a couple of other folks noted, like, you can just walk into CVS right now and buy an at-home test that you might do at your home with no infrastructure from other folks. And I don't know that there's one right way to do that, right? Like, and I can tell, I think a couple folks have preferences about what support mechanisms exist and things like that. And I think we've got to, I don't think there is a perfect way, right? I think we need to just try to, as a holistic movement, think about giving people as many options as possible. If they need and want support, try to build the infrastructure to give them that. And know that there are some people who maybe their preference is to take that alone. So I don't know, I not to try to put a bow on it, but maybe to put a bow on this conversation. I think there's also a lot that's going to happen that we're not going to have control over as a movement, right? There's going to be, COVID is impacting how people are getting medical care in a way that's moving really quickly. So just naming on the upfront that there's going to be a whole ton of ways people do it, and just thinking strategically about how we as a movement best prepare the movement to give as many people options and resources, I think is what we've got to be focused on.
Absolutely. Thanks, Lee, for sharing that. And I want to say thank you to everyone for joining us today. I want to thank Trevor, Hoppe for being here today. I want to thank Rita for being amazing and asking the best questions from our imaginary friends throughout the state. But yeah, right now is a break. We're gonna have a break time. You can pee, go get a sandwich, whatever you want to do. And at 3:15, we have 2 different workshop options for you to choose from. We have I Can't Breathe, Poison in the Air. We breathe and the water we drink. Lamicia Whittington, who's a friend of mine, will actually be doing that session. It'll be about climate and environmental justice and how it impacts Black and Native communities in North Carolina. And then we'll also be doing another session called Sex Work Then and Now with another friend, Roberto Olmo. We'll be talking about sex work, what it actually is, kind of go through the history. and then be able to talk about how the industry has shifted given COVID-19 and all of the different options. So if you're interested in that, if you go to your program, just click on the title of the session you want to go to, and then it'll take you to the Zoom link. I know we've been getting some emails from folks. All the links are in there. And then if you go to our website and look up Building Power Across the Spectrum program, all the links are there as well. So tell your friends if they just want to hop in throughout the day, or, you know, and hop on tomorrow, we can go ahead and do that. And then also today at 6 p.m. we have our welcome reception, which of course the links are all on the program. So again, thank you all so much, and I hope you all enjoy your break, and we'll see you in your workshops soon. Bye.